it up. And hey, everybody, thank you for tuning into another episode, another interview on the Art of Intervention project. Today, we get to hear from Patti Pike, and she's been in the industry for a while, been clean for a while, sober, whatever terminology some people like to use, right? But Patti, thanks for accepting the invitation to be a part of this, and can't wait to hear more about your story and about CanAm intervention. So when you describe yourself, Patti, how do you describe Patti Pike?
Wow. Yeah. Thanks so much, Rob, for inviting me here this morning. When I think about myself, I think about someone that has got an array of experience of working in the addiction and mental health and behavioral health field. Someone that has over 28 years in recovery. I call myself clean because I actually got clean from heroin. I'm an ex-heroin addict. And so I have got a lot of experience of different parts of my personal life, as well as, starting in the addiction and mental health field over 25 years ago. So I come with this complex kind of array of information. So yeah, I definitely look at myself as someone that has a lot of experience in this field.
Yeah, it's great. When you sit there and look at like today's day and age of the heroin and everything going on in our world today, I think of 28 years ago, you said you've been clean 28 years.
Yeah.
What was the heroin scene like 28 years ago?
Well, 28 years ago, actually, there was a dry in the early 90s. That's when really the epidemic of overdoses really started to happen, because I would say maybe around 1989 to maybe 93, there was a big dry up. There was not a lot of heroin around. So a lot of people were using other types of prescription drugs, because it was really scarce to get heroin. It was hard to get really good heroin. So in 1993, I was already clean for a couple of years at that point. And so in 1993, I actually got clean in Vancouver, British Columbia, Canada, because I'm a Canadian as well. And there was a lot of folks that started to overdose from heroin just because heroin started to become more plentiful. And so I would say 1993 to 1995, we lost a lot of folks to heroin overdose. Comparative to where it is right now, I mean, I look at Vancouver, British Columbia, because I'm a dual citizen, and I also got clean and I started working in the field, and also worked in the downtown east side where Gabor, Mate, and all these folks that were are really kind of famous now. But back in the day, I mean, there were a lot of folks that were dying from HIV and AIDS. So really, I started working with a bunch of research doctors that were really trying to, save these folks that were dying from HIV and AIDS. And so that's where I sort of came into working in the addiction and mental health field. And I was working as an addiction counselor at that time, and really working, I was working with hospice clients, and I was working with clients that were at hospital. I was working with clients on a day-to-day basis, really harm reduction approach. And so, yeah, I mean, it was interesting when I think back at where things were at back then compared to now. And I think about in San Francisco is where I live now. And I mean, what's happening in the Tenderloin in San Francisco, tents all around, that was not something that was happening back in the 1990s. I mean, people were using, obviously, coming from Vancouver, a very social country, it is a place to be if you're a heroin addict, really. But I mean, back then, you would get arrested if you got arrested for possession of heroin. Back then it was called caps of heroin. It would come into a balloon and it had 25 caps in there. And if you got busted for 1, 2, 3, you would get up to 7 years automatically. It was absolutely no, a lot of people ended up in prison because, they were heroin addicts, drug dealers, but you did not get away with the things that folks are getting away with right now. So anyway, I could go on and on about my stories about, it was actually the drugs back then it was a lot it wasn't so out in the open. Everything was kind of like hidden, and we used in apartment buildings and hotels and things like that. But now everything is so out in the open on the street, so it's completely different than what I knew, when I was using drugs. Yeah.
Yeah, well, yeah, thanks for sharing a little bit of that. I love getting to know people's stories a little bit too, and just
Hmm.
the evolution of our, you know, just countries, and how things change quite a bit, because now you founded and started CanAm Interventions, and I want to kind of give people a scope of like what you do with that, and then we're going to step back into what's the process of interventions and all this look like too. But
Sure.
what does
Yeah.
CanAm look like these days?
So CanAm Interventions, I moved to United States 12 years ago. And at that time, I had already been working in the addiction and mental health field for many years, since the early 90s. So 12 years ago, I sort of moved here. It was a new country. I was trying to acclimate, everything that I had learned professionally, and, to sort of embrace this as part of my profession. And I started working, in the Tenderloin, and I was working. I mean, I always ended up working in very kind of interesting areas. Like I worked in California Department of Corrections. I overseen like a lot of prisons, and I would go in and I would do all these assessments and get folks into treatment. I worked in like Baby Hunters Point, if anyone knows what that is, in San Francisco. It's a gang affiliated area. So I worked with a lot of women. I worked with women that were coming from, prostitution. And so I was really kind of enmeshed with like these folks from the inner city. And I was kind of like, to be totally honest, Rob, I just kind of got really burnt out at
Mm.
16 years of working in the field in many different areas. Executive director, I mean, right up to the front lines. And I was just like, okay, that's it. I'm done. And I didn't really know what I was going to do. And I really thought that I would go to work for Pete's Coffee, to be totally honest.
Yeah.
Like I was like, to that point, what, I don't really want to do this anymore. I'm done. I don't know what to do, but I don't want to do this. And what happened is that, as it always does, someone was put in front of me and said, you would be great as an interventionist. And I remember back in Vancouver Community College, and I remember taking the family education, or the family counseling program. And I remember being really kind of, really inspired and connected to the family system. And back then, I didn't really, it wasn't really kind of focused on, family wasn't really a focus on as much as the actual untreated addictive or alcoholic person. And I just sort of started thinking about that. And I started thinking about Virginia Satir. I started to think about all these different folks, Claudia Black, and, on and on and on, and Pia Melody. And I started to learn this language. And I became like kind of embraced with this person that was actually working in the addiction as an interventionist. And he started to mentor me.
Oh, cool.
And that was kind of where it started. And from my first call for an intervention, I'll just tell you this quickly. My first call for an intervention, I was up in Vancouver, British Columbia. It was 10 years ago. And I was sitting in the parking lot of I had already put up a little website. I hadn't done really the intervention training at that point, but I already had like a lot of credentials. I was licensed. I had, I was ICADC, internationally certified alcohol and drug counselor, California. I was CAADC. I mean, I had a lot of stuff going on. And so I got my call. I had this mentor. I was sitting in this parking lot at it was a coffee shop, and I had a notebook. I was actually eating a donut and a coffee, and I had a brown paper bag. And so I got a call for the intervention, and I took the name down, and I ripped that bag open, wrote down the name, and I wrote down the phone number, and I jumped off the phone and I called my mentor. And he actually told me all the things that I needed to do, and I needed to take this case. So I was like, oh my God. So I wrote everything. I still have it. Like, it's amazing. I wrote everything down. He told me how much to charge his family. I actually met the family, And that was it. I mean, so I formulated my contract, my pre-intervention package, how I was going to develop the intervention treatment team and the plan. And I did all that night. And that's where I actually formulated the structure of CanAm interventions. And because I'm an American and a Canadian, and I really didn't want to get away from my country, Canada, originally, I wanted to bring CanAm, and I put interventions. So that way I could be a dual citizen doing interventions across the border. And that's where it all kind of generated from.
I love you're saying that, because I was, as you were talking about, oh, I'm a Canadian, I'm American. I looked at the naming. I'm like, oh, of course,
Yeah.
Can-Am. But I wouldn't know that unless I heard the story from you too. So
Right. Right.
that's
Right.
great. So you just kind of it's almost like you were, everything prior to that was kind of putting you in this position. And
Absolutely.
it's almost like, I don't know. I mean, you mentioned this when we were kind of pre-talking, but yeah, like it was your calling and it clicked and you were off and running, right?
I knew from the first intervention, facilitating that intervention in British Columbia, actually, it was my first intervention. I knew at that point that that's what I was supposed to do. That was my next step in life, that I was supposed to work with families, that I was supposed to really help the untreated individual, advocate for them, and advocate for the family in a loving, caring, gentle, professional way. And I knew that that's what I was supposed to do, and that was it. I did not struggle whatsoever as an interventionist, coming into the field with my own business. I really didn't, and I stayed in my own lane. I did what it is that I needed to do to make sure that I was professionally sound by taking intervention trainings, even though there was folks that were in those trainings and people that were actually training. I had way more experience than what they had, working in the addiction and mental health field. But I was very humble, and I kept myself in my own lane. So people became and it was kind of a smart marketing kind of thing, because CanAm, people knew, oh yeah, CanAm Interventions, that's Patti Pike. She's a Canadian as well. So I just sort of went with it. And I mean, those first couple of years, it was really kind of, going around the country and, visiting a lot of treatment programs and really getting my name out there.
Yeah. Let's talk about like the family piece, because that's so important. And as you said before,
Excuse me.
that's okay. Yeah. I'll say again. So let's talk about the family piece, because you mentioned before, it was the focus in the beginning was kind of like all about the individual that had the addiction back when you got into the field 20 plus years ago. So now the importance of working with the family, what does that look like when you say work with the family?
Well, when I think about so one of the things that really inspired me was really the families that would call me when I was actually working one-on-one with people that were in active addiction or overseeing programs. It was the family that really kind of called me and talked about being held hostage by their loved one. And so that was the part that really kind of I started to investigate. What was that like for a family member? How were they feeling? How were they kind of really kind of enmeshed? And excuse me, I actually had to think about it in terms of the broader picture. So I looked at the family system coming from, the Claudia Black, Pia Melody, Dr. Peter Levine, Gabor Mate, all of these folks that were kind of really starting to speak different languages than the language of the 12-step model. And I didn't really want to kind of focus on codependency enabling. I didn't really want to focus on, because a lot of family members really kind of hear that all the time. And so my family program is, and what I do today is that I do the intervention and I really kind of work with the family, and I help to educate them, not just on the addiction model, obviously, because they really need to understand that their untreated loved one, is powerless over stopping using, and it's not sometimes about them thinking about going and using, it's the actual action. because once they're activated, they are activated. There's nothing that anyone can do, except they can, a professional can intervene, and they can step in and actually provide professional support. People that are using drugs, people that are in active addiction are very predictable. Okay, to me, they're predictable. When I go and do an intervention, I pretty much know what it is that I'm dealing with. I know the person that I'm dealing with professionally, personally. I can connect the dots with them. So families are not as predictable. So how do I, like, that's what I kept thinking, like, how am I going to bring this family system together where I'm not going to have, like, a brawl at an intervention,
Right. Yeah.
or I'm going to have someone that's going to have like wide open doors, that there's going to be a setup for me professionally that I am not going to be able to do the job that the family is paying me to do. So I have to educate the family. And I start that, right from the start, that I get my first call from the family, that's hiring me, excuse me, that's hiring me to do an intervention. I really want to do a family assessment, which I do. And in that family assessment, I develop a treatment plan for that family. So I develop an intervention treatment plan. And in that treatment plan, I want to define what are some of the real core issues here. Is it addiction? Is it mental health? Is this family completely in denial? Does this family know anything about anything? Are they emotionally disconnected? Are there some attachment? Are there some real kind of traumas that's happened in this family system that I really need to kind of educate? So in that treatment plan, I will develop, my family education classes, whether it's, really putting together PowerPoint presentations, lectures on the disease model. Am I looking at a harm reduction client here? Is my identified patient going to be a harm reduction client? How do I connect the dots in terms of the model of change within that family system? So the model of change is really kind of focused on, how do we get that family and how do we get that patient, motivated to make some changes, to make some decisions. So I use that kind of model as well for the families, when I'm actually interacting, and I use genograms. Sometimes I will get family members, I will get, I will have them break up in groups, if 2 or 3, maybe there's like 7, 8 people, I'll break them up. And I'll get one group to go in one room and one group to go in another room. I will have each group develop their own genogram. And then I will bring them back into the group as a process group. And then I will facilitate that process group. That's how I facilitate a lot of my interventions, and then from there, I'm able to determine what is the best approach in moving forward. Am I going to do a surprise approach here? Am I going to do an invitation approach? And from that, I decide with the family on whether I'm going to invite the person into the intervention, or are we going to prepare a surprise approach model for an intervention? And that's when we put the letters and so on and so forth together. And obviously the treatment and everything. Aftercare, the aftercare, intervention aftercare for me is really, because a lot of the times the patients go to treatment, if they don't go to treatment the day off, they usually go to treatment within that 14 days, as long as I got that family, really kind of following through on their boundaries, their limitations. I don't tell families to kick people out. I don't tell families to do anything, actually. I tell families, listen, this is where your recovery starts. This intervention is for you. It's not just for your loved one. Yes, your loved one is definitely will maybe eventually die if they don't get some support, they don't get some professional help. But this is just, if you're going to hire me and have an expectation that I'm a miracle worker, and sometimes that can happen. Sometimes I can go in and I can connect with the identified patient, and I can say, okay, and they already know that I know.
Right.
So it's very easy for me to make that connection. But I tell the family straight up, hey, listen, if you can't commit to this intervention, I will charge you right now for the hours that I've put into this. And, and that's that'll be it. Because if you are going to pay me as an interventionist to perform, a professional service for you, you have to be committed as well. You have to be committed. And so I need the commitment from the families. Now, sometimes the commitment may come in increments, as I'm going through. But if I've got a couple of people that are committed, and I know that I've got some people that's closed that back door and that I can work on that, I can build on that. So I really try and meet families where they're at, Rob. And I really try and bring in all my skills around process groups as well. I have a very good I connect very well with people, and I'm able to bring people together and support them and contain their emotion and support them as I kind of go along without doing therapy, right? Because that's
Right.
the key thing. I need to kind of like get this system moving. The aftercare is really, mostly what most people do is really getting the identified patient the help, finding out like what is it the family members going, what are they willing to do, to continue on their recovery process. A lot of the times it's like, phone calls, conference calls, obviously video, Zoom calls, being constantly in touch with the treatment team. If I've got a very complex mental health, I do a lot of mental health interventions as well, eating disorders, whatever it is. I mean, I'm able to facilitate those services. So I really kind of really enmesh myself with the treatment team without trying to tell the treatment team what it is that they need to do. Because, I need to stay out of that lane too, but I also need to advocate for the client while they're in treatment, and I need to advocate for the family. And while I'm going through that process, the family is having this constant trust in me. Sometimes I will make referrals to colleagues of mine, like psychologists that really focus on family systems, and I will, make those referrals. Obviously, I mean, it's the ongoing kind of 3 to 6 months aftercare that I provide for the families.
That's a great process. Thanks for that great detail that gives the family a real perspective of what to know, because it is a whole entire family system.
Oh, yes.
Right.
Yeah.
And
Mhm.
even though you can change one person in the system, which alters it a little bit, but when the whole family kind of buys in, I mean, you're essentially breaking really a generational, we'll just call it generational sin, curse, whatever people want to say,
Oh,
of a history of
absolutely.
addiction. And doing that, I mean, you're a legacy maker.
Yeah, I love it because I work a lot with attachment disorders and also mental health, and my theories and my ideas of folks that are entitled, that have been living and breathing addiction and behaviors that are affecting their lives. Maybe they're in law school, maybe they are like these, extremely bright people, but they have definitely have now, they're on the border of borderline personality because they have to survive at that point. So to try and educate family systems on trying to get them to back up, because then they're having to guess they're constantly guessing their story, right? Their loved one's story, because they're afraid to, go in and I try and use the analogy of the elephant in the room, and if you're prodding the elephant's, is going to go up. I mean, all these things are going to happen. And so everyone is backing off. So I'm trying to gently help them to gently, like, prod the elephant in a way that, there's love, there's compassion, there's also this understanding, but also there's some vulnerability between both. And some of these cases, these complex mental health cases where there is that borderline tendencies, you have to really take those, at an individual kind of level. Sometimes I work with the identified patient that I've sent to treatment, and I will work with them while they're in treatment, where they know I'm that like kind of middle ground person, that I'm kind of got their back, and I also got the family's back, so they can do the work that they need to do. So it's great. I mean, I love those kind of cases, just because, if you've got people that are sort of like have this desire and willingness, and they're going to go through this process of breaking down those cycles, you're going to get a very successful, not just patient that's getting treated, but you're also going to get a very healthy and successful family.
Yeah, and when they've done the best they can up to this point, right, before they meet you, and they've used all the tools they probably know how to do, and now you're giving them these new tools to say, "Holy cow! Now I can't wait to probably get jazzed about it. Say, I can't wait to like teach people about what I'm learning through this process." And so I
Right.
can imagine your referrals that you get from families that you've helped before is probably
Yes.
really a lot of ways that your business has continue to like grow has like it has.
Yes, I actually have had a lot of success in my business, and I really, I worked. I mean, I've had long-term case management families, and as up to 3 years. One I have in Canada that's going into my fourth year, and that's an amazing story what's happened there. And I mean, these are I mean, if you have families that are committed to staying on board, for that long period of time, because those systems are so broken. I mean, there's been overdoses, there's been all kinds of dynamics that's gone on, and so you're looking at these families that have been wounded, not just by the addiction of their loved one, but all these other dynamics that have been going on, maybe in their family. Maybe they were adopted, maybe they were in a foster home, maybe their parents were addicted, and on and on and on. So we have to kind of really look in depth of how to break down that system. But there has to be a patience as a professional interventionist, as someone that's trying to support these families. I must think about it like you got to take them by the hand
Hmm.
and take these baby steps, and that's really what it's like. I mean, as someone that's in recovery, I know what it's like when I got clean, and I was on methadone for 9 years, and I was kicking heroin, and I was kicking methadone, and all of those things. And I had to have someone that literally took me by the hand, step by step, to try and get through, like putting a sentence and a paragraph together, because those things were extremely hard. And it's the same kind of thing with families. When families are so fearful of really speaking to their loved ones, even though they want the best for them, but they're really afraid to put these creative sentences and these kind of ways of recovery, and they don't know how to put that together. So it's the same there. It's almost like the same kind of situation, that identified patients that are untreated are in those same types of positions.
Yeah, getting off the substances can be the easy part sometimes, right? It's
Right.
learning how to live life going forward. So from a definition standpoint, and people ask you like, how do I know my loved one has an addiction, and or what is addiction? How would you define those?
Basically, addiction comes in all aspects, right? Because we know that it's not just alcohol and drugs. It can be food, it can be, shopping, it can be, all these different video gaming, gambling, drugs, alcohol, obviously are the two that we're really focusing on mostly. I mean, not that these other addictions have not caused unmanageability in a person's life. What I always tell people is that when they call me and they say, hey, listen, I don't know, I'm not sure, because because the addicted person, the person that's untreated, they live in some cases, they live a double life. They present themselves, even though there's a lot of unmanageability going on in their lives, and their families have adapted to going like, well, it's just kind of like the way they are. Seems like they constantly are losing their ID or losing their phone, or, having some kind of a car crash, or just not really, so the denial of the family, they acclimate to, really sort of, you know, um, identifying their loved one as someone that is in that kind of state. I tell families, look, when a person has crossed over from manageability, especially with alcohol, because if people are using drugs for any length of time, we know, you know, that physically, mentally, emotionally, spiritually, all the, everything, all four areas of their life will become unmanageable. So that's going to show a lot quicker. Jails, institutions, hospitals, psych units, DUIs, drug cases, kicked out of school, lost jobs. These are all sort of, indicators that the person is progressing into addiction with drugs. When it comes to alcohol, alcohol is kind of an interesting one because um, people, when they start drinking alcohol, obviously alcohol is going to affect the brain, is going to affect the internal organs, is going to start to show signs physically, mentally, that there's something not right as a person progresses in age. But when you've got like a 20 or a 30-year-old and they go to college and all of a sudden they get picked up because they're drinking too much and they're partying too much, and then all of a sudden they stop and they start to become manageable again. When you start to see the patterns, where they have crossed that line, that's when a person is definitely, their life has become unmanageable because of alcohol. So there's a line that they start to cross where the manageability of alcohol is that they can have fun, they can be a young adult, they can, do those things. But when you start to see those patterns, you start to see like the person is constantly, being called up on something, lose jobs, disassociating themselves from their family, not showing up for events, family events. All these things are all indicators of isolation and living these double lives of being addicted to alcohol, drugs, or whatever it might be. It's hard. Sometimes you got to really kind of educate the families and help them, almost convince them that, look, I can educate you. I can let you know professionally. I'm a professional addiction specialist here. You're talking to someone that have done numerous of interventions. I've helped thousands of people in recovery over 25 years of working in this field. I've dealt with folks from all walks of life, that has lost everything: police officers, doctors, dentists, you know, people from all walks of life that have crossed these lines. So I try and really normalize it for families. But for me, I really try and like educate the family. And, I don't know, addiction is a disease, I believe. I believe that it's a disease, and it's like you check out. And it doesn't matter if you're only using like, say, 5 beers a week versus, if you're drinking 10, 12 packs a week versus someone that's drinking 5, what is the difference? Well, not because just because the person is only drinking the 5 beers, but they still may have the behaviors of someone that's completely addicted. They're just in this progressive state. So you always have to look at what the behaviors are. And I'm a big believer of getting people into treatment at an early age, like, 18. I work a lot with the young adult folks, and 18, 19, 21. I've got an intervention right now, 21 years old. I just got someone in, like, I don't know, a couple of weeks ago, 25. So, the earlier, the better,
Hmm.
So anyway, hopefully that wasn't too complicated, but.
No, well, addiction is one. It's a fascinating thing where some people even ask me, just at a cookout or something, like, "Hey, Lohman, come here. Do you think I have an addiction problem?" And I just ask them. I said, "Well, if you're asking, there might be some concern there, but
Yeah.
but two, it's kind of like, what does life look like when you run out of alcohol?" Is what I ask a lot of people. Like, "Well, I got to go get some more." I said, "Well, there might be a dependency on there as an addiction. I don't know. Only you can really know that in a sense." But earlier you talked about this models of change
Mm-hmm.
in our conversation. Talk to our audience a little bit, like, what does the models of change look like in.
So, actually, my good friend Ed Storty, and if you haven't had him on, I would suggest very strongly to get him on. He's, to me, the guy walks on water. So he's been doing interventions for many, 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 many years, and definitely definitely a mentor of mine, and someone that I have a lot of respect for in Los Angeles. he really kind of comes from a motivational interviewing perspective. So, you know what motivational interviewing is. And that was really kind of formulated from the model of change. So the model of change is like this pre-contemplation to contemplating to making a decision to taking action, right? And it was all kind of based on a relapse model perspective, where you get folks that were in treatment, they were pre-contemplating, they were sort of on the fence, on whether or not they really wanted to stay sober, clean and sober. And then they were sort of like in this kind of contemplative state, or I mean pre-contemplation. They were thinking about recovery, they were thinking about like getting clean and sober, and then in this contemplative state they were like, okay, this is kind of where I'm at, and I'm contemplating this idea of recovery. And then making a decision to jump from the middle, jump off one, you're not on one side of the road and you're not in the middle of the road, but you're actually jumping over to the other side of the road. So I think that, recovery is about joining the winning side, right? So if you're jumping over to the other side of the road, you're in this kind of state of making a decision that are based on recovery principles. What are those principles? You're starting to get honest with yourself. You're starting to make all these great decisions, and you start to feel this immense amount of freedom. So the action part is learning it. And then the action part is, taking that information and using it in your life, right? And then all of a sudden, if you don't continue with that action, you go back into this pre-contemplative state where you're actually either going to relapse or you're going to carry on with recovery. So families, when you think about families, right, because it's all really based on motivational interviewing. So you can actually start asking questions. Well, what is it like for you when you are using drugs? Like when I was working in treatment, those were some of the questions. I wouldn't say why. I would say, well, how does that work for you? Or what does that look like? And I might say to a family, hey, listen, what is it like for you when you see your son that's in the basement, that's been living there since he was, 19 years old, and now he's 50, and you're still like going down to check to see if he's breathing, right? I mean, these are real stories. These are real experiences that I have dealt with families, and so I talk to them about like, how does that feel? Because they don't have anyone in that moment to talk about those feelings of anxiety and how fearful it is that they're going to lose their loved one, that their loved one is going to die. And then so you kind of like really help them to start looking at like, what are some of the things that they can do differently, where they can bring in the professional that can help the identified patient, but also advocate for them at the same time. So you become like almost part of the family. And I like it. I like the model of change because I really try and describe that to the family to help them to get like kind of a bit of a foundation.
Yeah, don't you love it when you, like you said, being a part of the family, getting invited to like birthday parties
Yeah.
and all
Oh
those
yeah.
things. It's cool. They're just like, hey, a year later, it's like, hey, I want you to come to my 1-year birthday party, and that's
Yeah.
so emotionally cool.
Yeah. 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 And also I just wanted to say, I didn't really talk about this, but also I do, because I'm an educator as well, and I have a background in, I went to school, I did some training at Simon Fraser University back when I was working in Vancouver, and I used to work with the First Nation population. So, Native Americans in Canada, we call them First Nations. And so anyway, I took this training and it was all really focused on First Nation population. And it was a 2-year teaching adult education and really kind of putting together curriculums and on and on. So I never really thought I'd ever use it. 5 years ago, I was at a training, or 8 years ago, I was at a training, I think. And I was sitting there and I was thinking, this is interesting. I could actually do this. So out of that whole experience and thought, I developed a, um, a manual. So I provide intervention trainings in Canada and United States, and I have for the last 5 years. Um, and so what that means is that I have a 3-day training that really embraces my whole, perspective around interventions, working with families. And my training is very kind of practical. So I have a lot of practical exercises. I bring in a lot of professionals, like for instance, I got a training that's going to be, I had to cancel it because of COVID-19, but I have a training coming up in Malibu in September. And I've got like a psychologist. I've got Ed Storty. He's going to be presenting. Keith Furman from Cirque Lodge. They're all, and both Ed and Keith, if you know them, both of them are very, I mean, they were doing interventions long before many of these people were doing it. And a lot of folks that are out there doing it now. So I've got the two of them co-facilitating with me. Plus I've got, a psychiatrist. I've got I think there's probably there must be about 10 presenters. It's almost like a little mini conference. And I really wanted to raise the bar for trainings for folks that are, really coming into the intervention field. And I really want to make sure that they are professionally equipped with the education, with the training. And I really want to help them to get certified, because I'm a big believer that you need to, I did not get, this wasn't given to me. I had to work really hard to get where I'm at. And I really believe that you've got to go through the process in order to understand, and get that kind of hands-on experience of working with identified patients, having a caseload, having a case, being able to put together progress notes, being able to put together treatment plans, being able to do assessments, knowing how to do process groups, understanding the didactic education of what it is that you have to present, which is my background and my kind of that's how I sort of, that's my whole sort of perspective when I work with families and when I work as an interventionist. I bring in this whole sort of, background of I'm very structured. I'm a very, very structured individual. And when I'm working with families, I want to be very structured in my intervention process. Now, the aftercare, that can be a little unstructured at times because you have to be flexible in meeting folks where they're at. So, but this training is great. And it's like you don't get rich on trainings, just so you know, but the passion, I love to help other people and mentor. So I've helped a lot of folks become certified. Obviously, Canada being my country, I've really opened the doors there for, folks in Montreal, Vancouver, Toronto. So I have two websites, www.canaminterventions.com, and I also have www.interventionscanada.com. And I have those two sites. So I have folks in Canada that when I get calls for interventions, I can actually say, hey, listen, I've got a call here, and I will facilitate the process, but I will have that person, if it's the right situation, to go and do the in-person intervention. So it's great. It's really good.
I like that. Yeah. So I was looking at the training you had coming up in September, and I thought, what a spectacular thing that
It's
you're
going to
offering
be
people too. And so
awesome.
I'll have to put that on my calendar as a potential opportunity to shoot over there. For that. It looks amazing. So I'm grateful you answered that call, 20 plus years ago, or just to even enter this field of helping people, because now you're changing, thousands and thousands of lives every single year. And I want to go back to the person that's listening right now and thinking, okay, I need to call somebody. I need to reach out, and I need to be ready to talk to Patti or someone on her team. What are some questions they should think about before they call and to ask you or ask any interventionist as they're interviewing interventionists to say, hey, here's some important things you should really be asking before you hire somebody?
Oh, absolutely. Well, actually on my website, Canada, www.canaminterventions.com, there's actually I put together in the last couple of months, I actually put together, I can't remember the exact topic, but how do you hire an interventionist, or what to look for in an interventionist? I've got 2 documents there actually. And so being the person that I am and coming from where I came from, because I was born in St. John's in Newfoundland. I mean, I was born in Newfoundland on the east coast of Canada. So I'm an East Coast person. So, that was that. I mean, that'll give you a little bit of history of my passion and my integrity and my need to do things right. But also, when I got clean and sober in 1991, I knew I had no education. I had a grade 8 education. Okay, that was it. I left school. I left my family at 15 years old. Okay, and I started shooting heroin. Bottom line, that's basically my story. And I ended up in Vancouver, British Columbia, because it had the best heroin. That was the reason why I ended up in Vancouver. So my desire to help and mentor other professionals and folks that want to get in the field and are inspired to help other people is that I really believe in education, right? So I went back to school in 1993 because you needed to have 3 years actually in recovery at that time before you could take the addiction studies program at Vancouver Community College. And that's where I got my start, was at Vancouver Community College. And I took the 2-year addiction studies program, and I continued on, from there. But that was, and that's what I believe that, folks need to ask, families need to ask, the folks that they're hiring, what is your education background? Are you a certified intervention professional, CIP? What kind of experience do you have working in the addiction and mental health field? Because if you hire someone, they could have a great addiction education and experience background, but if they have no experience of working in the mental health field, that's a whole different that's the complexity of mental health is completely different than working with the addictive person. I mean, if you've got a heroin addict, an alcoholic that don't have any co-occurring disorders, okay, I'll give you that, because you can go in there as a recovering addict or an alcoholic and maybe have a little bit of experience, although I don't really believe in that, but you could go in there and shoot from your hip and maybe get that person into treatment because they got a 12-step model approach, right? That's work for them, so they can come from a 12-step model approach. I don't come, even though I'm in a 12-step program, but when people hire me, I put on my professional hat. I don't put on my 12-step hat. Obviously, it's part of who I am. So I come with being certified interventionist. I'm a part of the AIS, Association Intervention Specialists. That's an organization. I'm also a member of the NII, which is a Network Independent Interventionists. Folks that have been doing this stuff for a long time. I have a LADAC in California. I have an internationally certified throughout Canada and United States. I am a KDAC. I'm also a CIP, and also I'm an educator, right? So that's my foundation. That's my credential foundation. Now, I'm not saying that everyone needs to have that, but people need to, when you're hiring someone, you definitely need to have someone that is certified intervention professional. That is 100% sure. Because if you hire someone that doesn't have that, you're taking your chances. It doesn't say they can't get the job done. And it doesn't say that they can't put their sentences into paragraphs and put together a curriculum that's going to work for a family or work for that identified patient. I believe in internship. If folks are kind of in this process of trying to get to become an interventionist, and want to become certified, I think that you could actually work under someone like me where you are actually being mentored. I was mentored for 2 years. My mentor actually did not have the background that I had. He had more intervention skills than I had, but he definitely did not have the kind of education and the experience of working in this field that I did, right? But he was my mentor for 2 years. So, and I was humble enough to accept that, and, I think that it's really important to ask that question and, and find out if If they are, you can go on the Pennsylvania Certification Board. You can see if that person is certified. You can look and see if they're updated. You can look at all these different, if the person's got masters, whatever, you can find out if that person has been, has kept their, because you got to get certified every 2 years. So a lot of people, I'll finish with this because I know I'm kind of going on about it, but a lot of people will kind of go like, well, what's the CIP? And like, they will kind of like him and haw about it. But what I say to people, I said, look, the CIP, Certified Intervention Professional, out of Pennsylvania Certification Board, internationally, by the way, you can become, doesn't matter if you're in Canada, United States, wherever you are, that is the only, that is a board that will, oversees professionalism for interventionists. I always tell people, look, that's it. So if you want to put down, because of, you want to go through the list and say, well, they don't do this or they don't do that. But a lot of people that are interventionists, that are successful interventionists, that are doing this work, whether we have an opinion on what Pennsylvania Certification Board, we would like to see them do more. We would like them to add more things, but that's it. That's it. There's no other certification. That's it. So why would you fight that, right? And people do, as you know.
Yeah. Great advice. Great everything. I mean, what an awesome interview. And I just appreciate all you're doing. Again, making change all around the country, you guys. And it's canaminterventions.com or
Yes,
interventionscanada.com.
that's right.
Right.
Mm-hmm.
Yeah. Is where you can find more information about Patti and her team, and just inquire, you guys, because it helps the process to use a professional to help the family gain new tools and move forward to not have to repeat this again. And so I just want to say thanks so much for your time. It's great to get to know you, and hopefully I'll see you in September at what you're offering professionals to just grow in the profession of interventions and helping families change their system.
Thank you so much, Rob. I really appreciate being on today. And this morning I was trying to figure out like, oh man, I know I have this interview today and trying to prepare for that. Yeah. So anyway, it's good to be here and good to be a part of what you're doing. So congratulations to you as well.
Yeah, thanks a bunch. It's a lot of fun just to educate people, and that's what I'm all about too, and in
It's
the
good.
process of changing lives. So have an amazing day, and we will talk soon.
All right. Thanks so much, Rob. Have a great day.
All right, cool.